In this morning's Health Watch, the experience of chronic pain will take over your entire life if not treated properly. And with the possibility of addiction to prescription drugs, pain management is increasingly more important. Here now, Scott Dehorty is pain recovery specialist and manager of pain recovery program at Father Martin's Ashley. Thank you so much for coming in.
Thanks for having me.
Okay, this is something that we're seeing. Is this a growing number? Would you consider pain management or overprescribing an epidemic in our country?
It's a huge number, and it's an epidemic of grave proportions, absolutely.
And why is it? Like, what is chronic pain? How do you define that?
Chronic pain is any kind of pain that outlasts its original purpose, so anything greater than 6 months.
What is the, any number one causes, though, that stand out for you?
There's a lot of causes, so it could be injury on the job,
Okay.
Could be an injury, sports-related accident, could just be low back pain, headache pain. So there's any kind of pain. We sit too long. We live much longer than we used to.
Mm-hmm.
Our bodies aren't meant to handle this.
Okay.
So we're getting older and we're just in more pain.
And what you're seeing then are people coming to you because they said they're trying to find any way to do it. They have a prescribed drug that's been given to them. They either are abusing that, addicted to it, or they are limited and they don't have it anymore, so they go to alternatives.
Well, what happens is we typically have had one way to treat this pain, which is opiate medication.
Okay.
And when people take opiate medication for their pain, there's a segment of that population where it actually increases their pain rather than decreases their pain.
Why is that?
It's called opiate-induced hyperalgesia.
Okay.
So really, the opiates create more pain because the body wants the opiate.
Okay.
And so the body produces more pain in order to get the medicine.
What are, I guess, some symptoms of, I guess, people that are dependent then on certain prescriptions? How would you know if you were going to go into that, I guess, that section?
Right. Well, the pain recovery program at Father Martin's Ashley, we've developed this symptoms checklist, so this self-assessment. And so there are these 5 items.
Okay.
We have the evidence of withdrawal, which means once you stop using the medicine, your body reacts to it. That's really a biological process.
Okay.
We have kind of the, your life revolves around the medicine, so really you have this preoccupation. We also have that you're just taking too much.
Okay.
You're supplementing the medication either with alcohol or other illicit substances, and that your pain or your function is getting worse with the medicine. So if any of these are evident in your life, that may be a sign that further investigation is required.
And professional help is then the answer there.
Absolutely.
Okay.
Absolutely.
Scott, thank you so much.
Thank you.
We appreciate you coming in from Ashley. Thank you very much.